Hello, this is Dr. David Green, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today the topic is avoiding surgery for degenerative disc disease. Here's a picture of a normal intervertebral disc looking down on it. And basically, the normal you have is 80% water, and then the other 20% is collagens and protein. The best analogy is that of a jelly donut. So the outer, harder part of the donut is actually the annulus fibrosus, and the inner jelly part is the nucleus pulposus. Now this outer part, the annulus, does have some nerve endings. So when you have a little tear or some degeneration there, it can produce pain. The inner jelly has no nerve endings whatsoever. The disc normally acts as an excellent shock absorber with running, walking, jumping. As stress is absorbed, water is pushed out, and then water comes back in to give it its height back. As degenerative disc disease occurs, essentially what's happening is the disc is losing water content. So you can see that you have a normal healthy disc here, but as you start to lose water, you end up getting compressed, and actually it can bulge like a flat tire would. Okay, and then here you can actually start to lose the whole thing. 40% of the time when a person has back pain, it's the intervertebral disc causing it. It can actually lead to inflammation and irritation around the area of the disc, and it can inflame adjacent nerve roots and cause sciatica as well. Here's an MRI showing what degenerative disc disease looks like. You have the white discs here, which are normal and healthy. That's water. And as you lose the water, you start to get a black disc, and then as you can see the bulge coming back into the spinal canal there. Interestingly enough, studies have been done looking at people who have no back pain between the ages of 20 and 50. 35% of those have degenerative disc disease on MRIs. No back pain at all. So when a person is symptomatic, what are the treatment options for it? Well, first-line treatment would be over-the-counter medications like anti-inflammatories and Tylenol. Narcotics would be good for acute exacerbations when times are really bad. There's topical pain medications, muscle relaxers for the acute times. Physical therapy can be very helpful, especially with ultrasound and electrical stimulation. Chiropractic treatment can be helpful with manipulations and other things that the chiropractors do. TENS units are devices about the size of an iPod. They run off a battery, and they attach to foam pads that go over your back, and they can help with pain relief. Spinal decompression therapy is what you see in the picture here, and that's intermittent spinal traction that can decompress the areas that are where height has been lost, and that has an over 85% success rate with giving months of back pain relief. Acupuncture is also an effective treatment. When it comes to interventional treatment options, trigger point injections in the low back can help relieve muscle aching and cramping. There are some studies showing that intradiscal injections with steroid medication can be very effective for months of pain relief at a time. A lot of times what happens is you start to lose height in the disc, and the stresses get pushed to the back of the spine where those joints are called the facet joints. They can become arthritic and painful, so therefore facet injections or medial branch blocks and then a subsequent radiofrequency ablation could give months to years of pain relief. Epidural injections can be helpful if the disc is causing inflammation in the adjacent areas and nerve roots are being inflamed and sciatica is occurring. Epidurals can be very helpful. IDET refers to intradiscal electrothermal treatment. That's actually not performed very much anymore. Insurance companies aren't paying for it because studies show that it just didn't work very well. And mild refers to minimally invasive lumbar discectomy. Some pain doctors will do that in certain patients for pain relief as well. Now, one of the newest things for interventional treatments for degenerative disc disease is stem cell injections into the disc. Now, these are a little bit experimental. They haven't really shown adverse side effects, but there are some studies showing excellent benefits so far. And the different stem cell injections that are being looked at are from the bone marrow. There's also amniotic-derived stem cell injections that are being put into the disc. And then platelet-rich plasma therapy is also being used. Radiofrequency ablation is a treatment, as you can see here, that involves heating up these tiny little nerve endings around the joints in the back of the spine. If those are the cause of pain, this can provide 15 to 18 months of consistent pain relief. It's a great procedure. Outcomes, when they were looked at in this article by the World of Neurosurgery, they compared long-term outcomes for those with back pain who had a positive discogram in that level of the disc. It didn't show a significant difference in outcome measures for those who had surgery versus those who went non-operative. So it's not clear that fusion or artificial disc replacement for a degenerative disc is going to respond better than non-operative treatment. 3/4 of the time, patients are able to achieve a satisfactory level of baseline pain when they have degenerative disc disease and avoid surgery. Nevada Pain has the top pain management clinics in the greater Las Vegas area. They really are a one-stop shop. They have board-certified pain management doctors, chiropractors, PT, rehab, spinal decompression therapy, and acupuncture. They accept over 50 insurances. They've won the Patient's Choice Award 5 years in a row. So if you or a loved one is suffering from back pain or any type of chronic pain, call today at 702-323-0553 and look us up on the web at painmanagementlasvegas.com. I'm Dr. David Green with the Nevada Pain Network. Your pain stops here.